What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm doing wonderful. Hey, everybody. Thanks for listening once again to the Well Man's Podcast. Please tell everybody about it if you will. Let them know how much information we're giving out. And if you think we can help others, please get it out there. These are free, and Brian and I do it on our own time, mainly because we just like doing it and staying abreast of all the research that's out there.
Indeed.
So let's talk about PCOS and what it is and what it means. So PCOS is an acronym, stands for Polycystic Ovarian Syndrome. Syndrome gives you an idea about how we see it from a conventional medical standpoint. There's no real standard diagnostic criteria for it. It kind of has to have this constellation of signs and symptoms to get this diagnosis. Um, Not everybody with PCOS fits neatly into the signs and symptoms of PCOS. So we'll talk about that. But PCOS, of course, affects one gender, females, and one of the big things about it is it can really cause some fertility issues, and it affects between like 5 and 10% of women of childbearing age, and almost up to 90% of women with just irregular menstrual cycles. So irregular menstrual cycles are a big component of this. So it's basically a syndrome of having hormonal imbalances. It actually you get an elevated levels of androgen like testosterone, and even estrogen, as well as insulin levels. And this kind of gives you an idea of what may be going on and some of the signs and symptoms of it. So if you have excess androgen levels, right, a lot of these women who are dealing with this can get hirsutism, which just basically means, excess hair in places that they normally wouldn't, like on the face. Also, with the insulin levels, we're talking about possibly, obesity, being overweight. Most women with PCOS are overweight, but not all. So not all of them fit that. You can also get some discoloration of the skin, and you can also have, just hair loss, like almost like a male pattern baldness type of thing. And then also probably the biggest issue that I just brought up was just the fertility issues. So a lot of women with PCOS just have trouble conceiving.
Mm.
So
I like what you said about it being a constellation of like signs and symptoms. Kind of goes back to we talked about upper cross syndrome, lower cross syndrome. It's really just like a conglomeration of specific things going on that make this syndrome.
right.
For the conventional model, Keoni, or when we look at this conventionally, is it everything that you just listed? As we start adding more and more of those, we get more likely to be tossed under this PCOS umbrella? Or are there, the
Yeah,
hormone imbalances that are first and foremost kind of the key
yeah, I
ingredient
would.
that you maybe this?
Yeah. Well, it's really interesting because, as the name implies, PCOS, polycystic ovarian syndrome, you would expect, based on that name, that all women with PCOS are going to have polycystic ovaries, right? Well, that's not necessarily true. Most of them will. And the way to see that is with like vaginal ultrasound or something like that, to just see if these their follicles, just for a quick review, the follicles are where the eggs mature slowly but surely, and then ovulation is when those eggs are put out into the fallopian tubes, and that's where a woman can, is basically gonna conceive, basically in that fallopian tube, which will then go on and attach into the uterus. Well, with these women, a lot of them, these follicles don't mature appropriately. They don't get appropriate ovulation. So you can see all these like immature follicles within the ovaries, and they look like little cysts in those ovaries. And that's generally what the name means. But not all women have that. Another thing is we talked about menstrual abnormalities. Typically, women with the cycles, longer than 35 days, and then fewer than 8 menstrual cycles a year. Whereas most women, they menstruate every 28 days.
Okay. Okay.
Right, and that's kind of typical.
Yeah.
um it's just irregular. Some of them will not menstruate. It could take months before they do, or just have prolonged periods where they just have scant menstruation or heavy menstruation. It just runs the gamut there.
Yeah.
um
Well, it reminds me of like, so how we present with upper cross syndrome is like this postural positioning. And that's very, kind of
yeah,
very similar to what you just said there, as far as just how you begin to look under what falls under that umbrella. And then we actually look, and like, for my example, we see that the upper trap for upper cross syndrome is tight. And that's where like we're seeing these hormonal imbalances and just like further breaking it down.
yep, yeah, yeah. So it's kind of like, what is the constellation of signs and
Right.
symptoms that fit the best is going to kind of give you that diagnosis.
'Cause syndromes are
I tend to
tricky.
think about, yeah, and I tend to think about with women. I mean, I somebody comes into my clinic, and I see a lot of women coming to my clinic who are just having trouble, um, conceiving, and they tend to be overweight, and they may have elevated blood lipids, based and elevated insulin level, maybe even an elevated hemoglobin A1C, where they may be, like pre-diabetic or anything like that. I will tend to think of PCOS as being a potential problem.
Okay.
You can also, and then we talked about the signs of like the excess body hair and facial hair, the hirsutism. You can also see, since they have excess androgen production, you see, like a male pattern baldness in some women. You may even see some adult, onset of acne. Um, it's interesting because you think people would fit neatly into
Right.
kind of the textbook of PCOS, but as we know in medicine, it's rare that a lot of people do. As far as the prevalence of hirsutism, or the facial hair, body hair, it's even, it seems to be different among people of different ancestry, right?
Mm.
So um, it may be more common with this in people of darker skin, um, whereas people of Asian descent not even be affected in that way. So even with the ancestry can affect that. So based on what your genetics are, um, but the telltale sign is just having those cysts in the ovary.
Yep.
Um, the other conditions, as which we brought up, is infertility is the big one. Obesity. More than half the people with PCOS have they're overweight or have excess fat.
Do you
Maybe
think that's a,
pre-diabetic.
symptom of falling under PCOS, or it's a path towards PCOS?
It's interesting you say that. I think one begets the other. I mean, I think PCOS can help make you put on weight pretty easily, and obesity can help bring you towards PCOS.
Yeah.
So it's like one can beget the other.
Yeah.
And the same thing, and with obesity, what's happening? You get an insulin resistance. You're getting some of that excess androgen production. You're moving towards diabetes. Um,
Definitely throwing your
some
hormones off.
Yeah, oh yeah,
No doubt
yeah,
about
and
it.
that's what I can. It's definitely, like, I think you hit the nail on the head there. It's a hormonal dysregulation,
Mm-hmm. Mm-hmm.
is a good way to see it. And another sign that you can see that is something called Ancothis nigricans. It's basically a medical term for hyperpigmentation, and usually you see that in like the nape of the neck, the armpits, the thighs. It's usually a sign of insulin resistance, and it, it can spill over into the skin and lead to abnormal skin growth in the skin. So some of the things associated with hyperinsulinemia is having excess skin tags on your skin, So, where you get this like excess skin growth, and then also kind of this hyperpigmentation of it. So based on all of that, we basically you've said there's no definitive diagnosis of PCOS. It's one of exclusion. Um, if you have a constellation of some of those symptoms, it's probably likely that you'll get that. I think most physicians, if they see, they're going to probably recommend a transvaginal ultrasound to detect whether there are cysts or if the follicles are arrested where you're not getting appropriate ovulation. I do know one of the diagnostic criteria by the Androgen Excess Society, this is in 2006, required there to be hyperandrogenism, so excess androgens like testosterone, and then menstrual dysfunction, or the polycystic ovaries. So it's either menstrual dysfunction along with the high, androgen levels, or high androgen levels along with the polycystic ovaries. And based on that, you can pretty much make a diagnosis. So, for me, I like to see blood work
Yeah.
when I see this, and you can tell a lot with this. A lot of times you'll see high levels of what's called luteinizing hormone compared to FSH. And just for our listeners out there, luteinizing hormone basically helps the follicle, helps with ovulation, to the release of the follicle. Follicle stimulating hormone just helps the follicle kind of grow. And typically you see high LH relative to FSH,
Mhm.
and hormones there also, like uh, thyroid stimulating hormone, and progesterone. Um, and then also in the blood work, you definitely will tend to see, I shouldn't say definitely, but tend to see high glucose, insulin, cholesterol levels, and triglyceride levels are a little bit high. Some doctors will run what's called an AMH, anti-Mullerian hormone, and it's considered a potential diagnostic for PCOS. So, so still some more work to do there. AMH, it's just a protein that's released by cells that are involved in the growth of the follicle, and they correlate with a number of these, what they call antral follicles, but look like these cysts. And women with PCOS typically have a higher number of these antral follicles. It's basically antral. The medical term for that basically means that it's a hollow follicle, which is part of the maturation process of the actual follicle. And so they'll have higher AMH levels as well. So that can help you with your diagnosis. Um, it's one of those things that can be so frustrating for people who are trying to get pregnant. And
Yeah.
we've talked a lot about some things there, and we've done a number of podcasts on, you know obesity, weight loss, a lot of lifestyle issues that can really, really help this. And I've had a number of people in my clinic where they were diagnosed with PCOS, they're trying to get pregnant, and without even going into the medications that we'll talk about in just a minute, or the supplements, I had a lot of my patients, again, we went back to sleep. Are you getting enough sleep to help balance out the hormones? And then intermittent fasting in a way that doesn't put stress on your body, but lower blood sugar levels and also insulin levels. And that alone has helped a handful of my patients to get pregnant with diagnosis, just doing that without really giving them anything. Of course, anybody trying to get pregnant, I always recommend them getting on a good prenatal and fish oil and stuff like that, which also has some research to show that it will help. But there are simple things that people could do. I don't want people to listen to this podcast and think, oh, well, I've been diagnosed with PCOS and I can't get pregnant. That's not true. It's a little bit more difficult to get pregnant, but even with some lifestyle changes, you're able to do that. So, and I look at PCOS as just kind of like one of those, it's kind of one of those things, like on the continuum from health to disease, it's like if you have PCOS, you're along that continuum to, problems later on, whether you're
Mm-hmm.
trying to get pregnant or not.
Mm-hmm.
So it's like one of those things that, you definitely want to try to get a handle of, and try to get a handle of it with lifestyle stuff alone.
Yeah. Yeah, I think that speaks to the fact that it's a syndrome, kind of like we were talking about. It's not, one specific disease process that's going on that we need to address. If you're thinking about that continuum, and again, I'll just go back to my example. Before you get stenosis of your neck, you probably have upper cross syndrome, and you kind of move towards this as you get, or move towards
Right.
something more sinister as you go down that continuum. And if you can intervene at each step, and it seems like syndromes, just as a whole, it's just fascinating me, but it seems like a syndrome in the medical community, basically one step before a more serious, specific, and
Right.
treatable diagnosis.
Right. That's exactly right. It's interesting how PCOS kind of is very similar to metabolic syndrome, right? I
Mm.
mean, which is like one step before, you know, it's like pre-diabetes moving into diabetes.
Yeah. Yeah.
So, um, as I implied before, luteinizing hormone, it's one of those things that triggers ovulation. But if you have too much, it can trigger premature ovulation, which isn't good, right? You want the follicles to mature before you actually ovulate. So a lot of research points to this excess LH as the driving force for PCOS, and especially the driving force into people that don't fit the stereotypical signs and symptoms. So from people that are slender and normal body weight, and I've had some of these patients where, there's nothing really that you can see on the outside. They're not overweight. They tend to look very fit and slender. And anyway, the LH may be the driving force behind their PCOS.
Mm-hmm. Mm-hmm.
So anyway, you certainly can have the tall, skinny, fit woman that has PCOS. So I don't want people to think that you can't have that.
Mm-hmm.
Um, let's see. It's very interesting the way insulin works in the body. Um, when you have high insulin levels, and then on top of that, you also have high luteinizing hormone, it tends to enhance the production of androgens. So that's one way you get an increase in like testosterone. And anytime you have testosterone, you're more likely going to have a more powerful testosterone called dihydrotestosterone. We talked about this before. So if you have a lot of testosterone floating around, you're going to be more likely to convert some of that to dihydrotestosterone. And dihydrotestosterone is kind of the testosterone that leads to, the excess hair production and the male pattern baldness. So in males, you'll see higher levels of that. And so there's some things that you can do to help mitigate that. The other thing it also does is having insulin levels, it reduces sex hormone binding globulin. And sex hormone binding globulin is one of those things that you want to have around in your blood, because what it does is it takes excess testosterone and bounds it up so that it can be biologically active. All right. So don't have a lot of this around, and where it can feed testosterone to the cells in an appropriate, optimal way, you're going to get too much of it, and then you'll see these symptoms. So just to reiterate that, excess insulin levels can cause a reduction in sex hormone binding globulin, which then, like you were saying before, can lead to hormonal imbalances.
Mm-hmm.
It's interesting. Some women, especially if they're young, like adolescent, prepubescent women, they find that uh, if you mature prematurely or not at the standard ages, then sometimes you'll get excess testosterone production and irregular periods, which can lead to you being more likely to have PCOS. There are other factors. So we know that we live in a world that, we are constantly being exposed to inflammatory insults in whatever our lifestyle be, and I'm just going to use that as a general term. So lack of sleep, maybe over exercising, eating the wrong foods, all that stuff can lead to chronic inflammation. This is why those lifestyle things that I just talked about, sleep, intermittent fasting, eating appropriately, can really help. But also any environment that you're in to where you are exposed to environmental chemicals, many of which are endocrine disrupting chemicals that can mimic estrogens and other hormones, that's going to throw things off too. So a lot of times I tell my patients that let's look at like your cosmetics and make sure that all that stuff is clean and not exposing you to anything excess. And yeah, I get a little neurotic here as far as telling people to avoid certain things. Like I'll even mention to my people, because I think it makes a difference, is yeah, if you're drinking out of plastic bottles all day, every day, it'd be better to drink out of glass. I mean, there's a little bit of exposure there. What is your work environment like? Do you work in a work environment where you're constantly getting volatile organics in the air? We all have that in the air, but if you're working in a paint factory where you're constantly smelling some of these chemicals and getting exposed, then that can be an issue. And that may push one over the edge and make the difference between being able to get pregnant and have a viable, birth later on, as opposed to not. Autoimmune disorders play a role in that. So, checking all that out, and then going through medications and making sure that the medications that the person is on is not causing a disruption in hormones too. And as we know, there's some medications that can certainly do that.
Right.
So and disrupt hormones. But with that being said, that part of the or to get people to get out of this infertility cycle is conventionally they will treat with hormones, and they'll do it in such a way that hopefully helps balance things out. But as soon as you start doing conventional treatment, it triggers something in at least for us and our listeners, should make them think, well, anytime you're doing that, okay, what are you giving up? What are the negative side effects that are going on now based on that? So that's why, as with our therapeutic order, we talked about this a lot, start from the least invasive treatments like lifestyle and move down the ladder to the more invasive treatments as you need. The other thing about PCOS is we already talked about that it can lead to, it's associated with higher rates of diabetes. It's also associated with higher rates of cardiovascular disease. I'm sure it's even associated with higher rates just because of the hormonal balance of possibly reproductive cancers and things like that. It's just one of these things that you want to get under control. So anyway, let's talk about some conventional treatments, and then we'll go into the natural things and what I do to help these women. One of the biggest problems for women, and I've had a number of women over the years come in with the hirsutism where they just feel like they're getting excess hair growth, which can be very disconcerting. And besides having them do electrolysis and all this stuff, there are some things that can be used that can help lower luteinizing hormone and also androgen production. And one of those are oral contraceptive pills. All right. So when you take progesterone also, which can be part of the oral contraceptive pills, you can get an increase in sex hormone binding globulin, right? Which will reduce free testosterone levels, thus reducing dihydrotestosterone. There's another medication out there called spironolactone. It's used primarily as a treatment for hirsutism and women with hair loss, and it's basically has anti-androgenic effects, and that's basically the way it works. So that's another thing that you may see. Probably one of the medications are on that with PCOS, and it is metformin, which all the prescription meds out there, I really like metformin for a number of reasons. There are people taking metformin now that don't have any issues because of its anti-aging effects. But metformin also holds promise managing hair growth, helping stabilize glucose and insulin levels. And it's kind of one of the mainstay treatments to help with PCOS. And it can work in combination with some of the natural treatments really well without some of these, some of these glucose tempering drugs. A lot of them would have side effects, and some of them are not appropriate for people who are trying to get pregnant. But metformin doesn't seem to have any of those negative side effects. Like a woman should be able to get pregnant being on metformin without any problem at all. In fact, it should enhance their chances. So that may be one conventional route that people want to go, especially if they are trying to get pregnant. So with infertility, another thing that they'll use a drug called, have you heard of Clomid? Anyway, it's one of these medications that can help induce ovulation, and it's basically considered an anti-estrogen medication. And what it does is it basically causes the body or the pituitary gland to balance out the secretion of luteinizing hormone and follicle stimulation hormone based on it lowering estrogen in the body. And then it can help with ovulation. And those two hormones, as I said, help with, maturing the follicle and helping with ovulation. So Clomid may be a thing that people may want to do, but it comes with some side effects. I had women in my clinic who just could not stand the side effects of Clomid, like the weight gain, just feeling bloated, fatigued and stuff like that. Not all women have that, but that is a fairly common side effect of that. Times Clomid would be given in combination with metformin. Another thing you can do is what's called aromatase inhibitors, right? And those drugs basically are another way to help lower estrogen levels and thus helping with ovulation. There are natural aromatase inhibitors that I've actually used. So things like diindol methane, DIM. What else? There's a number of natural ones that can help with that. One of them would be like flaxseed may help balance out hormonal levels also. But these are, you just talk to kind of a natural medicine doctor that help with giving you natural aromatase inhibitors if you want to try that route first. Certain foods can help with that, making sure your liver is functioning appropriately. Things like broccoli, cabbage, cruciferous vegetables, anything that falls in that family can certainly help with that. Surgical techniques that can also help, which should be on your, should be at the bottom of the therapeutic order, so to speak, before you even think about doing that. One of them's called laparoscopic ovarian drilling. That's a nice name, but it's it's basically one of those things that can look and try to, I think what they're doing is getting rid of the androgen producing cells down the surface of the ovary. And so basically the goal of doing it is just reducing androgen levels to help with ovulation. And I think that is pretty much kind of what I want to talk about as far as the conventional stuff. Let's see, just as a review with that, let's think about like taking care of the obesity as we can. I certainly don't want any of my patients who are trying to get pregnant to go on crash diets, and I certainly don't want any of my patients who are trying to get pregnant overdo the intermittent fasting. Especially I tell my patients if they're doing intermittent fasting, and once they become pregnant, they should probably get away from that and stay away from that, especially prolonged intermittent fasting, until they're done nursing, if they plan on doing that. High blood pressure, diabetes, we're gonna get rid of that. We know with high insulin levels, we get high blood pressure, which leads to cardiovascular stuff. Makes me think of, and I know you're probably thinking this too, Brian, because we always bring it up, one of the things that helps with any type of insulin issues at all, or blood sugar issues and high blood pressure, is magnesium. So magnesium is one of those things that can certainly help. Lots of pitfalls with conventional treatment. So, like birth control pills. We know that your, birth control pills may be able to help with PCOS, but they also can make you more prone to blood clots, and there's other issues associated with them. Same with the fertility drug Clomid. Cause mood swings, hot flashes, breast tenderness, abdominal cramping, nausea, even more serious side effects with that. So it's one of those things where I just say, well, let's focus on like the lifestyle and dietary stuff. So let's go into that, because that's where my is, and I think that's what people are listening for here. So let's talk about the things to do. So, and I'll specifically relate it to people that are, trying to get pregnant and increasing your chances. So first thing, sleep. We've had a number of sleep podcasts. Listen to those. Those things are really a lot of good information there that can really help people. Intermittent fasting. We had a number of podcasts on that. It is interesting that some research has shown that short-term, like ultra low calories per day, kilocalories per day, like 500 kilocalories per day, can decrease androgen signaling, and of course will reduce insulin and help with PCOS. So that's very interesting. Kind of speaks to the intermittent fasting thing. Diets high in monounsaturated fats have shown to increase insulin sensitivity, which is what we're going to do. High fiber foods cause less insulin to be secreted. High fiber diets also increase sex hormone binding globulin. So we want to make sure that have a lot of that sex hormone binding globulin to help temper excess androgens and help balance hormones. Fiber also reduces the risk of metabolic syndrome and lowers lowering cholesterol and blood lipids. A moderate in dietary carbohydrates may also help improve outcomes in PCOS. So that's kind of the lifestyle stuff. But what about the nutrients? So if somebody is trying to get pregnant and had issues with it, one of the first things that we always do, and conventional doctors will recommend this too, is put them first on a good high potency prenatal. That's the main thing. And if they're really good, they'll recommend fish oil. So those are the first two things that I do: high potency multi with fish oil.
Mm-hmm.
Another thing that I will do is I'll use a compound called inositol, which is sugar alcohol, and I'll use different forms of it, and usually dose it pretty high to get it. So there's a couple forms of inositol: myo-inositol and then D-chiro-inositol. And myo-inositol, which is usually what you can find in the supplement, is converted to D-chiro-inositol in the body. So I just dose with, when you looking at the supplement rack or whatever, going to buy inositol, if you find inositol, that's really all you would need to try to get an improvement. But
Can you give us the spelling?
Always best to talk to a doctor. Inositol is inositol.
Okay.
Yeah. And basically what it is, it's a structural component of the cell membrane, of the cell membrane and the lipids. It basically is in cell-to-cell signaling. So just think about it as taking it, and now your cells throughout your body just communicate better.
Right.
All right. And it's just fascinating to me that in a number of studies, it's demonstrated that it improves insulin sensitivity, improves your metabolic markers. It helps normalize reproductive hormones. It can help restore menstrual cycles, especially in women with PCOS. It has been shown to increase the quality and maturity of the oocytes. So these are the cells that go on to become the eggs. And it, based on all that, it appears to enhance fertility in women with PCOS. So in a comparison study, here's one of them: 4 grams of myo-inositol plus 400 milligrams of folic acid per day. It was more effective than 1,500 milligrams of metformin. 1,500 milligrams of metformin is kind of the standard dose people work up to that they take with PCOS. But anyway, okay. So 4 grams, now that's a lot, right? 4 grams of myo-inositol compared to 1,500 milligrams of metformin, and it helped restore ovulation in infertile women with PCOS. And the total pregnancy rate was also higher in the inositol group compared to the metformin group. So almost 50% compared to 37% with the metformin group. So that's one study with myo-inositol. And another controlled trial, you had 50 overweight PCOS women taking either 2 grams of myo-inositol with folic acid or 200 micrograms of folic acid daily. And after 12 weeks, the people taking the myo-inositol had decreased insulin, testosterone, prolactin levels, and increased markers of insulin sensitivity. Their menstrual cycles tended to be restored. And there's a number of studies out there that is important, that show benefit. There's also studies on D-chiro-inositol also showing benefit with PCOS. And so a lot of times I will try to supplement women with the combination of myo-inositol with D-chiro-inositol because they both seem to have benefit. The D-chiro-inositol should be dosed a little bit lower than the myo-inositol, but your doctors will know that. There's another form of inositol called D-pentanol, which occurs naturally in foods and stuff. And it also showed by taking that hemoglobin A1C improved, glucose improved. There's not as many studies on regular inositol, but overall, things tend to normalize as far as the sugar levels taking that one. Mm-hmm. So, and you can find the supplements where you can get 2 or 3 of those combined in one. A lot of times your body will convert inositol into those anyway. So that's inositol. That's kind of like my mainstay supplement that I'll use just based on the research, but there's many others. One is N-acetylcysteine. Talked about this a lot, right? N-acetylcysteine, when we did our glutathione podcast, it's a amino acid that's high in cysteine, and it's basically an antioxidant that's used to produce glutathione, your body's most important antioxidant and detoxifier. So it's very safe to take. It improves insulin sensitivity and it helps restore fertility. And there's some studies that show that. And it's not going to affect, even if you're doing conventional treatment, any problem with, for example, if a woman's on Clomid, they're going to be fine taking inositol and or NAC. And NAC even tends to make Clomid more effective. So that's pretty cool, right? When you see like a natural compound helping the pharmaceutical compound just work better.
Right. Yeah.
Let's see. One of the things. Oh, and one of the reasons why you get increased inflammation, or you see an increased inflammation with women with PCOS, is they tend to have elevated levels of homocysteine also, and that's an inflammatory marker. And one of the reasons why I want them on a good high potency prenatal is because that can help temper that or lower levels of homocysteine. The other thing that will help lower levels of homocysteine is metformin. So metformin, I should take that back. I'm getting ahead of myself. When you take metformin, you can get an elevation of homocysteine. So it doesn't decrease homocysteine, you get an elevation of homocysteine. So one of the reasons why I want them on these supplements is to just help temper that response. So that's one of the negative side effects of metformin, and NAC can help lower that. So I didn't want to confuse our audience out there, but metformin can increase that inflammatory marker. We talked about magnesium. I'll just leave it at, magnesium does a number of things for helping with insulin resistance, and it even helps temper androgen levels. Magnesium almost seems like it can, if you don't have enough testosterone around, it helps elevate. If you have too much, it will help lower it. Magnesium is things that it's one of the, kind of my go-to supplements for just about every type of chronic condition out there. The worst thing that can happen by taking too much magnesium for most people get a laxative effect. So it depends on the form you're taking.
Mm-hmm.
So the form we use is one that's highly absorbable, and I tend to use the bisglycinate form. One thing that lowers inflammation too, we talked about this on a number of podcasts, is curcumin, but it especially seems to help women with PCOS. 500 milligrams of curcumin twice a day had a significant reduction in insulin over a 6-week period. It also seemed to help with significant reductions in glucose and DHEA and any like steroid hormone precursors compared to placebo. So it's almost like it's an insulin sensitizing thing. And also we know that curcumin is anti-inflammatory. It's one of my main anti-inflammatories. I use natural anti-inflammatories. Another thing that will help with sugar levels, you've heard of chromium, right? For taking chromium for helping with diabetics or pre-diabetics. A lot of times I'll put people on what's called a high potency diabetic multi instead of just a prenatal with PCOS, because it has higher amounts of the chromium in there, which has been shown to help. And it improves, and of course it improves glucose tolerance, which is an issue for PCOS.
Right.
Another thing in that multivitamin that I'll use is lipoic acid. And the reason why I use it, because again, that's been shown, lipoic acid can be shown to help with PCOS. And I'd be remiss without even mentioning vitamin D. So vitamin D levels, got to make sure those are optimal. It certainly seems to help with women who want to become pregnant, making sure their vitamin D levels are optimal, especially if they're dealing with PCOS. One of the things I use with a high potency prenatal, I really like omega-3 fatty acids. There was an Australian study that showed that it, of course, decreases cardiovascular risk factors, reduces fatty liver content. Fatty liver is one of these other things that can happen with excess insulin floating around. It also seems to help lower blood pressure. And overall, it just helps the liver function more optimally, which is important because that's where most of, that's where sex hormone binding globulin is made. That's where a lot of your precursors and proteins, all these transport molecules that are needed throughout the body are made. So you definitely want to make sure your liver is functioning appropriately, which is really important to go through your medications. If you're trying to get pregnant, get rid of the alcohol, anything that is an insult to your liver. We definitely want to support that.
Yeah.
I don't use flaxseed so much in my clinic as far as supplements, but I will tell my patients to definitely put them in their diet. And there's powerful lignans in flaxseed that have anti-estrogenic effects, just helps out balance out hormones. I just think it's a good thing to do. It has been shown to help with decreasing possible hair growth, the hirsutism, and just helping balance hormones. Another one that people can probably guess is cinnamon. We know that cinnamon is very good for optimizing sugar metabolism. It's not going to hurt people taking cinnamon for helping their sugar levels and triglycerides, LDL levels, and cholesterol levels. And all of that is going to with better outcomes of PCOS. and just optimizing insulin. So insulin is one of those good things. I just tell patients that, use your spices. We talked about that quite a bit in our spice podcast way back when.
Yes.
And now
Yes.
they're go ahead.
It just seems like a lot of these are circling around that insulin sensitivity and just focusing on
Oh yeah,
that.
right. And and I'm circling around to that because that's that's this constellation. That's one of the main things that seems to be a problem with women with PCOS, but not all. So
Right.
like you really, as a practitioner, you kind of have to do your homework and see really where the problem is. But even so, everything that I've mentioned is certainly not going to hurt somebody who may not have the stereotypical insulin sensitivity to try, because you will get benefit with it.
Yeah, absolutely.
Some simple things that women can do to also help with optimizing hormones is spearmint. How about spearmint tea, which I think is delicious? There's a study of 42 women divided in two groups. One took spearmint tea twice a day for a month and the other placebo. The spearmint tea group showed significant decreases in free and total testosterone and an increase in luteinizing hormone and FSH. Well, when you see that, you know that they're going to be more likely to probably get pregnant when you see that type of thing happen. So it seems to be a good natural treatment for hirsutism also, especially in PCOS. I mean, these are easy things to do that you're just not going to get in trouble with. And then a tea that I recommend is green tea. It's known to have a positive glucose metabolism, improving insulin sensitivity. It can slow the progression of diabetes, and it's actually been shown to lower hemoglobin A1C. Right? If your hemoglobin A1C is too high, it's diagnostic for diabetes or pre-diabetes. So, and drinking green tea is one of those things that has a very little side to it, especially if you like it, right? One of this is interesting, and this is something that I don't use a lot of, but it is one of the things that I've had in the back of my mind and known about it, is using licorice root. And you can actually use licorice root, do licorice tea, and it is shown to help reduce serum testosterone levels and helped optimize the menstrual cycle in some women and lowered, the hair growth and all that. Anytime you use testosterone secretion, you're going to lower the other signs and symptoms that come, like the facial hair and all that. It's actually pretty neat because, one of the treatments that they do conventionally is they give spironolactone, and it's pretty much given to help prevent the hair growth and the female pattern hair loss. But it's also associated with several side effects. And spironolactone originally was given as a diuretic. But so there's a number of side effects with that prescription drug. And it was interesting when licorice is given to women with PCOS, it kind of counteracts the negative side effects of spironolactone when they're used in combination. So I find that fascinating, which I wasn't really aware of until recently. Yeah. Some of the studies out there. So that would be something that I might start doing also, either given like a licorice solid extract, or doing some licorice tea that certainly is not going to hurt.
Mm-hmm.
What else? One of the herbs that I will use on women, and it's stereotypically known as a male herb, so to speak, is saw palmetto, right? And
yeah,
and saw palmetto inhibits the activity of an enzyme called 5-alpha reductase, and when you inhibit that enzyme, then you therefore reduce the conversion of testosterone to dihydrotestosterone. And if you reduce that conversion, then you don't have a more powerful dihydrotestosterone floating around the body, creating hair growth and male pattern baldness. And and it can help reduce acne and stuff like that. So anything that can reduce that conversion from testosterone to dihydrotestosterone, like the herb saw palmetto, is good. So in this case, it would probably be a good choice of herb to use in a woman suffering from PCOS. And what are the negative side effects from that? Slim to none. So, and my whole mantra is, why not, if you have some studies to support its use and the likelihood of it causing harm is really not there, then why not try it?
Right.
So anyway, that's kind of basically what I wanted to go through with PCOS. Should I just recap, Brian, real quick?
Yeah, real
with
quick.
Stuff?
Mm-hmm.
All right.
So we know obviously we have to get our lifestyle in order. We always start there. That's always like our on the, what am I trying to say? On the board game of life and health and that continuum we were talking about. We're always starting
and the
with the lifestyle.
Exactly right. That's exactly right. And the most important thing to me is sleep and intermittent fasting for this, at least.
Okay.
We know, we talked about it being a syndrome, right? The characteristics, the main characteristics are irregular menstrual cycles, ovarian cysts, elevated luteinizing hormone. Sometimes you'll see obesity, you'll see higher hemoglobin A1Cs, blood sugar issues also, but that's not always the case. But irregular menstrual cycles, excess male hormone production, and just a chronic lack of appropriate ovulation. That's the main thing. So the conditions associated with it are infertility, central obesity, insulin resistance, cardiovascular disease, anything associated with that, high blood pressure, stroke. Causes of that, are basically go back to lifestyle, which anything that's going to affect you to put on weight. Early age onset of puberty can also cause that. The conventional medical treatments, metformin is a big one for the hair growth, for optimizing hormones, spironolactone, sometimes oral contraceptives. For the infertility, Clomid is one of the things that docs will use. Dietary lifestyle recommendations, sleep, exercise, maybe reduce dietary carbohydrates, especially the refined carbohydrates. Exercise, walk would be the main thing, but any type of exercise. And then my integrative interventions that I use are forms of inositol. We know that they can improve insulin sensitivity, blood pressure, triglyceride optimization, testosterone levels, optimizing them. And overall, what we're really trying to just improve ovulatory function. NAC improves insulin sensitivity, restores fertility when added, right, to the drug Clomid. So that's a big thing that natural practitioners can do. Just add that if you're taking Clomid, that can help. Any prenatal that has chromium in it, or possibly lipoic acid, or you can take it separately. And then one of the herbs that has the most research on it as far as helping with optimizing sugar is insulin. Is cinnamon. And some of the other herbs that are really good that I love, mint teas. Mint teas are good, especially spearmint tea is also good. So that's pretty much it. And just so people know, you can find these notes basically were written by a colleague of mine. Her name's Dr. Maureen Williams. I want to give her credit for getting these notes together, because certainly I didn't have the time. And these notes are part of Life Extension's notes under polycystic ovarian syndrome. So people can basically use this podcast and use the notes, polycystic ovarian syndrome, Life Extension, Dr. Maureen Williams, who is a naturopathic physician. Basically, I went based off her notes and her article on this PCOS, so people can look at that if they want to have something in front of them to read.
Awesome.
Yeah.
Cool. Anything else, Keoni? It was good education for me, that's for sure.
Yeah, well, yeah, and it's a great review for me. So, no, that's it. Hopefully, that will help people out there. I have a few clients in mind that I'm I'm going to definitely refer them to this podcast. It's one of the reasons why I want to do this podcast, just to get it out there so people have something to listen to.
Yeah, absolutely. Until next time, everybody be well.
Take care, everybody. Bye.